Hi, I'm Dr. James Nill of Nill Family Chiropractic and Wellness Center, and today we're going to talk about elbow pain. There are three kinds of elbow pain that I see mostly in my office, and one of them could be called medial epicondylitis or golfer's elbow, lateral epicondylitis or tennis elbow, and there's also pronator teres syndrome, which can actually mimic the same thing as carpal tunnel syndrome, which is the tingliness in the hand. Okay, every joint in the body has a series of muscles that help stabilize that joint. The most famous one is the rotator cuff, but there's also some pretty much with every joint that helps stabilize it. So when we have an elbow problem, let's say medial epicondylitis, a lot of times it's because the lateral or extensor muscle group is weak. So what we want to do is work on both sides, and we do origin insertion therapy. So I can come in here with my hand and dig in here and work all the way down around the insides and outsides. And the same thing applies for lateral epicondylitis. You just work on the opposite side. But what I also do is I actually get what's called gua sha therapy, which comes in here and we get a little bit deeper. Now it looks like a very intense tool, and it doesn't feel real well when you do it, but the results are absolutely outstanding. And that's what we do to treat tennis elbow and golfer's elbow. Now another thing we want to do is when we're done with that, come in here and manipulate the joints a little bit. And that's how we can help treat that. Now another thing we want to be aware of is what's called pronator teres syndrome. There's a muscle that comes over here that helps with pronation of the forearm. But the median nerve goes underneath that, which is the same nerve that gets trapped underneath the hand, which causes what's called carpal tunnel syndrome. But there's a nerve that comes off here, so if it's pronator teres syndrome, usually the whole hand. If it's carpal tunnel syndrome, it's usually some of this part of the hand and lower. But most of the time I usually treat both just in case.